This webcast and any accompanying materials are copyrighted by the American Association for Respiratory Care. Any public display, sale, copy, or distribution of the video or materials may only be undertaken with the prior written consent of the AARC. Copyright 2013, all rights reserved. My name is Shauna Strickland. I am the Associate Executive Director for Education at the AARC. I welcome you to today's presentation. Interdisciplinary Communication, Strategies to Improve Patient Safety. Upon completion of this AARC webcast, participants will be able to explain how information is processed and what can go wrong, describe the multiplication effect, list the top 3 root causes of sentinel events according to the Joint Commission databases, and describe the benefits of communication training for healthcare providers. I am pleased to welcome Cheryl Hoerr. Cheryl obtained her BS from Rockhurst University School of Respiratory Therapy and her MBA from the University of Phoenix. She is president of the Missouri Society for Respiratory Care and is active at the national level through her work as a member of the AARC Benchmarking Committee and chair of the Program Planning Committee. She was honored as a fellow of the American Association for Respiratory Care in 2008. Currently, she is the Director of Respiratory Services at Phelps County Regional Medical Center in Rolla, Missouri. Cheryl discloses that she has no conflicts of interest related to this presentation. Cheryl, welcome to the program.
Thank you, Shauna, and welcome to everyone who's attending. And I hope I'll be able to share some good information that you can take back with you into the clinic setting and improve patient safety. I will let you know that they just issued a tornado watch for our area. Hopefully it will stay a watch and not turn into a warning. The good news is we're in respiratory therapy, and respiratory therapy is always located where? In the basement. So I'm in a tornado shelter, so hopefully even if we get to that extreme, we'll be able to continue our education session. All right, let's get going. So why is effective interdisciplinary communication so important? Well, you know, healthcare has become increasingly complex, and our patients are at significant risk when they access care. Poor communication among healthcare providers continues to be a primary cause of sentinel events, leading to patient injury and even death, unfortunately. As providers continue to feel the impact of reduced reimbursement related to poor quality care, they must develop more efficient strategies through which they and their coworkers can monitor patient care situations and support each other and communicate more effectively in order to provide better quality care and avoid those unfortunate outcomes. I'm hoping that this presentation will provide you with some basic communication tools that you can implement and facilitate more accurate patient care delivery by communicating more effectively with other healthcare team members. And as I said, hopefully this will help deliver better patient quality care. You know, we are facing problems so complex that we can't take care of patients on our own. We need the entire team to lend their expertise and work with us to get that patient well and out of the hospital. And if your organization is anything like mine, you've seen a drop in inpatient census, but the patients we do see are increasingly complex. They are much sicker, and we've been saying that for years, but they still continue to get even more complicated, and they're really not hospitalized until they're very ill. So we have to bring all of our skills, all of our training, and all of our expertise to bear in order to care for them very effectively. Healthcare reform will change how we do our jobs, and how we do our jobs is changing on a daily basis because we're being asked to do more with less, do it more quickly, do it more effectively, and that's why communication is a critical issue. And you're going to see a little bit more about that in the next coming slides. Adequate staffing is something that everybody focuses on. Well, we could do a better job if we had more therapists. We could provide better care if we had more nurses. But according to data gathered by Joint Commission, that's not necessarily true. Joint Commission says that while adequate staffing is obviously important, poor communication by healthcare workers is 3 times more likely to be a contributing factor to a sentinel event than inadequate staffing levels. And as you can see, for 2010, 2011, and for the most recent data that they've posted in 2012, communication remains in the top 3 of root causes of sentinel events. In fact, 60% of sentinel events are the result of ineffective communication. And of that 60%, 75% of those sentinel events lead to patient death, which I think is a really sad indictment of how we provide care. We have to get better at communicating amongst ourselves, not only ourselves as respiratory therapists, but ourselves as the entire healthcare team, in order to provide better care and safer care to our patients. So how do we communicate? How do we gather data and come up with a plan of care? Well, the first thing you need to know as a healthcare worker is all the data about your patient. All those data bits, you know, the blood gas and the lab work and their x-rays and all their testing and their symptoms and their assessment. All those data bits are crunched in your head, and you come up with a pattern. Aha, I know what's happening with this patient. It's XYZ. And based on that pattern that you identify, you prioritize what's going on with your patient. They've got A, B, and C. A is most important, so we'll develop the primary plan of care around A and address condition B and C as we go along. That's how we ordinarily process information, fairly straightforward. But there are a lot of things that can go wrong with what is essentially a straightforward process. If you're gathering data, maybe you don't get all those data bits. Maybe you miss something that's the key to actually identifying the correct pattern. Maybe the data is complete, or you only get the data. And what I mean by that is when somebody tells you, well, their PO2 is 75. Does that help you? Not really. Is it 75 and they're on 100%? Are they being ventilated? Are they on 2 liters? Is it room air? You all know that. So making sure that you have a complete set of data is critically important. If you don't have the right data, chances are you're going to identify the wrong pattern, or you're going to come up with an incomplete pattern. You might diagnose A and C, but you don't realize that there's also a B component in there, so that you don't completely treat that patient. And there is no doubt that we have a lot to do. And the more you have to do, the more you tend to get tunnel vision and only focus on what's right in front of you at the time. You deal with that task, and a lot of times you forget to go back, reassess the situation, and reprioritize. Those are some of the things that can go wrong. That's a very high-level overview of what can go wrong when you're prioritizing and processing information. On top of that, that's kind of an individual thing, gathering all that data. When you're working with the interdisciplinary team, there are other challenges. Yes, you may know who you're working with. You know, I've got a doctor, I've got a nurse, I've maybe got a imaging tech, I've got the PT/OT speech therapist, whatever. But maybe I don't know all the details of their discipline, or what they want to do, or what they have identified. And so if I don't know them personally, if I don't know them professionally, how can I have confidence in their skills and their ability to treat my patient? So there's that distrust and lack of confidence. And every discipline has their own vocabulary, their own way of communicating, and if I don't speak your language, how am I going to communicate effectively with you? And if I can't talk with you, how can I learn to trust you? Poor communication is also encouraged by lack of information sharing. The doctor may know something that for some reason doesn't get shared with the team, or the imaging tech has information that hasn't been posted yet, and so the team doesn't know about it. Or maybe the doctor has passed on a bit of information to the nurse, who's passed it on to the respiratory therapist, who passes it on to the next person, and it's like that old game of telephone. The first person had a very complete view, but the last person at the end of the line maybe doesn't have all the pieces. There's been a degradation of information. There can be some confusion as to who's actually leading the charge. Who's in charge today? Who's deciding what we're going to do with this patient? Is it the doctor, who may come in for 10 minutes and then leave? Is it the care coordinator, who's trying to get this patient into the right level of care, who's trying to get them discharged, who's trying to get them all the pieces together to say, yes, they can be discharged today, or they need to be moved to rehab? All of that can be very confusing to an ancillary service like respiratory when they come up. I'm just here to do my treatment. You know, I really don't want to get involved, but what we do can actually help or hinder that whole process of care coordination. And we all know, working in healthcare, there are old structures in place that kind of hinder what we're trying to do and how we're trying to move forward in modern healthcare. There's the old hierarchy, you know, the doctor's in charge and that he's at the top of the pyramid, then nursing, and blah, blah, blah. And whether you believe that, it's still there. That structure in the background is still there, and it may hinder what we want to do with that patient. There's some defensiveness with that comes with that. Complacency. Yeah, we've seen this all before. We know what's going on. We'll do X, Y, and Z, and we'll be fine. You know, chauvinistic attitudes are all over the place, and we all have very brief, time-limited interactions with our patients, with our coworkers, because Lord knows we have so much to do that you cannot spend all day with one patient. It would be nice to be able to provide one-on-one care, but we have a lot to do, and in order to do justice to our entire workload, then we definitely need to make the time that we have to work with this patient effective, and in order to do that, we have to make sure we're working with the entire interdisciplinary team. So there are a lot of distractions, a lot of defensiveness, confusion, poor communication, ignorance, all of those things on top of the difficulties that we've already discussed about data gathering. And then to make matters worse, we also have the multiplication effect. And if you think about it, think of the people you work with. Lots of different healthcare workers. Those healthcare workers may have lots of different levels of expertise or experience. You've got the new grad, you've got the student, you've got the person who's been on this job in this position for 10, 20, maybe 30 years. Sometimes the 30-year veteran is not necessarily the one with the best expertise. Maybe it's that new grad student who has the most up-to-date information. So you have to be considering that when you're working with all these different people. You're working with a lot of different professions and departments in trying to provide care to your patient. Patient has multiple patient problems. They never come in with just one diagnosis. There's usually a whole laundry list of things going wrong, and you have to keep that in the back of your mind. Yes, we might be treating them for CHF as a primary diagnosis, but what about these 10 other comorbidities? We also have to keep our eye on that. We as therapists have multiple responsibilities. I'm just not here usually at your bedside, but I've got this floor, I've got coverage in the ED, I might be part of the quick response team or the trauma team, I might be covering blood gases or pulmonary functions or EKGs. So we've got lots of responsibilities, and we're not the only ones. Everybody on the healthcare team has other responsibilities that they need to accomplish throughout the day. And complicating all that, we're expected to be an expert on multiple pieces of technology. How many different ventilators do you use in your department? How many types of non-invasive ventilators do you use? Nebulizers, different oxygen delivery devices. There's a lot of complication in all of that. So when all of those issues are bombarding us as we try to provide care, we tend to lose situational awareness. That means the conflicting information, the confusing game plan, poor communication, production pressure can also be taken as a push for more productivity. All of these things cause us to develop tunnel vision and makes us lose sight of the big picture. Not only what's going on with our patient, but what's going on in the unit and further on in our department. That means everybody has their own idea of what's happening or what should happen with the patient. And all of these challenges happening all at once in a compressed period of time can cause us to lose our patient focus. We get caught up in the moment, and we really don't do a quick situational check to verify that the circumstances are still the same with this patient, or maybe they've changed, which would call for us to make changes in our plan of care. So one of the things that I'm going to talk about further on in this presentation is how we can gain back our situational awareness, and that's one of the critical keys to ensuring that we are providing the right care for the right diagnosis to our patients. So, take a deep breath. Think about what we just talked about, all the issues surrounding communication and everything that can go wrong with data gathering and treating our patients and communicating and working in the clinic and trying to do our jobs. And holy cow, it's no wonder that we make mistakes and errors occur in healthcare. And when you consider all that, why is everyone so focused on working together as a team? Why would we ever put a team together in healthcare if we have to deal with all the problems that it causes, as we've already discussed? Well, it seems like it's more risky to give team treatment than not. But the reality of it is, no one discipline can do it all anymore. No one discipline can provide 100% of the care that a single patient needs. We have to work together to achieve that common goal, to get our patient well and get them back to their pre-hospital location, whether it's home, whether it's a nursing home, whether it's independent living, whatever. Because our patients need all of our expertise to get them well. And so we have no choice but to work together and work together effectively. In order to work effectively together and in order to provide quality care to our patients, we have to be able to effectively communicate with each other, and that's the focus of this presentation. Effective communication is just not optional. Nursing is not a standalone entity, and neither is respiratory therapists. I know physicians think they are. I know we make a lot of fun about physicians, but they are starting to come around, especially the newer, younger generations realize that they are part of a team. And sometimes administration can be a big challenge because they've got their own agenda many times, and sometimes we don't necessarily agree with where they want us to head. So that can bring another layer of complexity into our daily goal of treating our patients effectively. So effective communication is necessary in order to plan and carry out safe, effective patient care. And how are we going to do that? Well, unfortunately, communicating effectively really doesn't come easily. I mean, you think, okay, I can have a conversation with you, I tell you some stuff, you say okay, and we've communicated, right? Not necessarily. We assume that we communicate effectively, but when we receive no formal training in the skills and techniques necessary, you can't always ensure that in the workplace setting you have communicated effectively. That old saying, just because I said it doesn't mean you heard it. Just because you heard it doesn't mean you understand it. And just because you understand it doesn't mean you're going to do it. Effective communication means when I say it, you hear it, you understand it, and it happens. So that's the definition of effective communication. And when HC Pro did a survey, it's probably been about 3 years ago now, 72% of healthcare workers who replied said no, they've never received any formal training in communications. And when you think of how important communications and teamwork are to providing care these days, that's kind of sad. Why are we ignoring such an important piece of providing care and not training healthcare workers in communication? Because if we did, we'd have better interventions. We'd be able to problem solve more effectively and efficiently. And effective communication also means we have better time management skills. So let's talk about some of the problems that can occur in trying to achieve situational awareness. Remember, I said that situational awareness is the ability to know what's going on, the ability to make sure that you are remaining patient-focused, that you haven't gotten caught up in the moment, that you know what's going on, that the circumstances are still what you think they are, it's still an accurate view, and therefore you're still providing accurate care to your patients. It's critically important for all team members to have some level of understanding about what's happening around them in the clinical setting. We can't work in a vacuum or practice with tunnel vision, because that's when the error does occur. When someone is working independently, hasn't done a situation check, isn't involved with the rest of the team, or the rest of the team isn't involving them, that person is working, doing what they think is correct, but the situation has changed, and therefore what they're doing is actually not the right thing. So it's critically important for everyone to develop their situation monitoring skills. It's a process of stepping back, taking a deep breath, and taking a look around. Even in the most mad, hairy situations, you need to be able to do this. Some of the people with the best situational awareness are fighter pilots. You consider a fighter pilot in the midst of a dogfight, and they have got to have an acute level of situational awareness. They need to know what altitude, what speed they're going, how many shots they've fired, what ammunition and armaments they still have left. They need to know what's above them, under them, to the sides. They need to know what the rest of their teammates are doing. They need to know what the enemy's doing. They need to know how far they are from the deck and what their altitude is. All these things going on in split-second timing in order to be successful. And if you think about it, we're kind of the fighter pilots of the healthcare team. Think of all the things that we as respiratory therapists deal with in a code. You know, we're helping with CPR, we're helping maintain the airway, we're getting blood gases, we're a lot of times, you know, helping to monitor the patient's hemodynamics. We are helping with intubation. We may even be starting IV lines, putting A lines in, pushing drugs, depends on what we're going on. Depends on what's going on. So I think that we as respiratory therapists, as part of critical part of the healthcare team, need to make sure that we are stepping back, raising our head above that dust cloud of trauma and craziness and saying, okay, what's going on? Coming up for air and taking time to look around, in the room, in the hallway, on the unit, to a larger extent in the hospital, etc. You know, if I'm working in the ICU, I want to know what's going on in the ED, because chances are, if the ED is crazy, I'm going to be crazy soon. All right, I need to prepare for that. If I'm up in the ICU, I need to know what potentially is going to happen on the next shift. Has anybody called in? Are we short? Are we picking up? Is our equipment working? Do we have enough ventilators? Do we need to order any med-surg supplies? I, as a therapist, need to know all that, and I need to be communicating not only with the rest of the therapists on shift, but I also need to know the nurses to know, hey, we've got some vents ordered. We just used the last one in the ED. We've got another couple coming in on rental. They'll be here within the hour. So everybody is on that same page. We need to know if we're going to have to make a change in our process because of what's going on in the environment. As I said, today we're under a tornado watch. What happens if we suddenly are elevated to a tornado warning? We knew that early this morning that was a potential. So what we are doing is making sure we've talked with all our patients to say, hey, this is going on. It may be that we need to do an evacuation from your room later on this afternoon. Just want you to be prepared. If I didn't know what was going on, I couldn't prepare my patients. So that's the external environment situational awareness that I have right now. So it's an individual skill that you all need to work to develop to make sure you continue and you have a good level of situational awareness. That's your individual skills. And because you know what's going on around you, you have that situational awareness. And if you have that situational awareness, then you need to encourage the rest of your team members to have that situational awareness. Hey, take a look around, see what's going on, go check that, give me a report, that type of thing, so that everybody on the team raises their level of situational awareness too. We all need to be on the same page, but it starts with you. It starts with me. What do I know about what's going on, and how can I improve my knowledge? If I have a good understanding of what's going on all over the place, I have a good situational awareness individually, and therefore I can help each member of the team have a good situational awareness individually, and when we come together, the entire team is seeing the same thing at the same time. So make sure that everyone has a clear, consistent picture of what's going on at any specific point in time. So, how do we get to that point? The point where everyone is oriented to the current situation, communicating effectively, and therefore providing the most effective quality care to that patient. Well, it starts with you, making sure you're ready to work. And anybody who's gone through the Team Steps training program, which I highly encourage you all to do if you have the opportunity, will be familiar with a couple of these tools in the next couple pages. I need to start with my situation because I cannot provide the best care that I can deliver unless I'm ready and prepared to be able to do that. All right. So I go through the I'm safe checklist. Am I feeling well today? I mean, yes, we've all come to work when we're not feeling good, but you all know that if you're not feeling good, you're just not as sharp as you are on a day that you are feeling well. So is your illness something that's going to negatively impact the care you provide? And we all know that we're not supposed to come to work when we're sick, right? I'm sure none of you do, but too many of us feel that we're critically important and no one can get along without us. If you're sick, stay home. You do yourself a disservice. You do your patients a disservice. So, are you ill? Are you on any medications that may negatively impact the care you are providing? All right. It might be something as simple as an antihistamine or a decongestant that slows you down, makes you a little dull. You need to be aware of that, and maybe if you are working, take steps to say, hey guys, I'm a little under the weather today, I'm a little slow. Keep a check on me, okay? Are you stressed? Stress will do terrible things to your concentration. We've all been there. We've worked with people who have had a lot of stress, usually from an outside source. So you have to make sure that when they are working, their concentration is focused here at work and not on what's going on outside of the hospital with their family, with their housing situation, whatever. If that level of stress is negatively impacting the care they provide, then it's up to us to say, you know what, maybe you need to take the day off, deal with what's going on, and then come back tomorrow refreshed. Obviously, alcohol and drugs are a big no-no. We've all had brushes with coworkers who've had problems with that. It's our responsibility to make sure that we come to work ready, not with the hangover. And if one of our team workers and coworkers are under the influence, it's our responsibility to make sure that they're taken care of. Fatigue. Fatigue is a big one. The United States is very bad about people not getting enough sleep. I think I saw something on the news recently saying most people only get about 5 hours of sleep a night. It's not enough to prevent fatigue, and that's cumulative. If you aren't sleeping enough, you're not focused, you're not as sharp as you could be, you may be at higher risk for causing an error in patient care. And do you have time to eat? Take your breaks. Take your bathroom breaks. I know that's funny, but how many times have you gone the entire shift without going to the bathroom? That's not good. Take care of yourself. So once you've gone through the I'm Safe checklist, you can say, yes, I'm ready. I'm ready to work. I'm safe to work this shift, and I'm ready to go. So once you are ready, then STEP into your patient care load. And STEP is an easy acronym to say this is the next step. Once you're ready and prepared and you're good to go, then assess the status of your patient. Your patient always comes first. Find out what's going on with your patient so that you have just a general understanding of their situation, what their most current data bits are, what their diagnosis is, what the plan of care is, and so you're prepared to treat them. T is for team. As I said, you make sure that you use the I'm Safe checklist to check yourself. Maybe you need to have your team members do the same, or you do it for them to make sure that they can provide an acceptable level of care to that patient, and they will be able to back you up when you need help. So check your team members. E, assess the environment. Make sure you know what's going on in the unit, in your organization. Make sure you know what's going on in the ED. Make sure you know what's going on in your department and your equipment and your supplies and all of that stuff that you need to get through a shift successfully. And then finally, P, assessing the progress towards the goals that have been established, not only for your patient, but for your department and your team members. Yes, we have goals that we want for our patients to accomplish. You know, we want you to, we want to be able to teach you these things today. We want you to accomplish this level of PT, where the goal is to get you home tomorrow. But we also have things that we need the department to accomplish. You know, we want to make sure that we're starting our therapies within our established time limits. We're not missing therapies. We're able to gather the data for our performance improvement initiatives. We are doing all of those things that have been established as goals for our department, for the hospital, that type of thing. And making sure that you are planning for what's going to happen the next hour, the next shift, the next day. The more you can prepare and plan forward, the easier your job and everybody else on your team's job is going to be. So you're safe. You've used the I'm Safe checklist. You've stepped into your patient care load. And now you're going to make sure that you're under control. You're going to make sure that you check on your other team members and make sure that you're supporting them, that you're acting as a safety net for them. And cross-monitoring your teammates does not necessarily mean following them around to check and make sure that they're doing everything right. Yes, you are, but it's not a negative check. When we first started this, I had a therapist come to me very upset and say, well, so-and-so is checking my charting. It's like, okay, did you talk to them about it? They're just going behind you to make sure that what you're doing is accurate, that it's according to our policies and procedures, and that it's complete. You have every right to go behind them and check. Make sure their events are set appropriately. The alarm limits are set. The parameters are set appropriately. Make sure they're sorting their workload and prioritizing their patients appropriately. You can talk about those things, and by doing that, you become familiar with their workload. They're familiar with your workload. You can act as a backup for each other. You are that safety net if anything goes wrong. It's like, hey, I've got to go to a trauma. Can you watch my patients? Sure, fine. I'm familiar with it. We've talked earlier. And you can catch those mistakes or any oversights early before they become a big issue, before they cause a safety event or an error. It's essentially watching each other's back. And making sure that when we're all stressed and crazy busy, it's always nice to have another set of eyes watching what you're doing. And if you've got that trust, if you've built up your communication skills and you're communicating effectively so that your teammates trust you and you trust them, it's not a negative thing. It's basically a positive, I'm here for you. Tell me what I can do to make your day a little bit easier, a little bit smoother, and it becomes very second nature to seek out help. Hey, I'm starting to go under. Before I do, can you come over here and help me? Or offer it. You seem a little frazzled. What can I do for you? You know, you haven't been to the bathroom here. I'll cover your phone for 10 minutes. Go. You know, your tongue is sticking to the roof of your mouth because you haven't had a chance to grab anything to drink. Run down the cafeteria. I've got it, you know. So cross-monitoring, it's another way that you can maintain situational awareness because you're aware of not only what's going on with you, but aware of what's going on with your teammates. It's a way to eliminate and catch errors before they occur. There are also some tools that teams can use to improve their teamwork. They're called mutual support tools. We've all heard about feedback. And unfortunately, feedback a lot of times has a negative connotation. Feedback should be timely, respectful, specific, and really focused on improving. And you have to consider people's feelings and deliver negative information with fairness and respect, and too often that's not done. But when it's done correctly, feedback can be a very positive thing. It can really provide some wonderful professional and emotional growth to your coworkers. The DESC script that's mentioned there, you use that when you are resolving conflict. DESC is a constructive approach for managing and a lot of times resolving conflict. So D is describe the specific situation or behavior, and you can't say, well, you always do this, or you know, this is all, you know, this is always the problem. You have to say, on Saturday, the 25th of September at 8 o'clock, here's what I saw. So concrete dates, because it's that specific situation or behavior that you're addressing. D, so describe the specific situation. E, express how the situation makes you feel and what your concerns are. So you're talking about a specific situation and how it affected you specifically. S, suggest other alternatives. Here's what I do in that situation, or here's what I've seen work effectively. So suggest some alternatives. And then C, consequences. Should be stated in terms of their impact on the team goals. So if you don't do it this way, here's what happens to our performance improvement numbers. Here's what happens to our patient satisfaction scores. So we need to get everybody to agree that this is the way we're going to do it. So DESC is a constructive approach when you have a lot of conflict and you need to provide feedback. The two challenge rule is a way that you can express concerns when you're in a situation and you're not sure you understand. It is your responsibility to speak up when those situations occur and to voice that concern twice before you take a stronger course of action, such as notifying your upline or calling a supervisor, that type of thing. So let's say you're working with a nurse or another respiratory therapist and you're not sure what's going on. You ask, hey, what are you doing? I'm not familiar with that. Are you sure that's right? I was thinking that it should be this way. That means you said something twice. The person should acknowledge, yes, I understand, but here's why I'm doing it this way. Or if they don't, that's when you take it to a higher level and make sure that what they are doing is correct. And it might be that they are. You've challenged them. If they don't provide you with an acceptable explanation, then it's your responsibility to continue questioning at a higher level until you understand, until the situation is resolved in the patient's best interest. Advocacy and assertion is something that I think respiratory therapy are very good at. We tend to be a very good advocate for our patients when we don't think things are going the way they're supposed to. Advocating for non-invasive ventilation instead of intubating, or advocating for certain diagnostic tests that could help us rule out a diagnosis. So I think that's definitely what our strong point is. I think if there is a role model in your institution, learn from them. There's always one or two who are very good about advocating for the patient and going to the physician and getting what they need. And find out, watch them, learn from them, ask them questions, find out what they do and how they've developed that relationship and how they became such an advocate for the patients. You know what's right for your patients. You know what should happen. So make sure that that's what you're doing. If that was you or a loved one in that bed, you would certainly want me to advocate for what's in their best interest and not just say, oh, they'll be fine, or oh, I'm too busy, I've got to go take care of this other patient. It's like, no, I'm with you. I'm going to advocate for the best care for you and make sure that you get what you need. Finally, collaboration is I didn't talk about cussing. If for some reason you are trying to assert that something is wrong, that you don't feel comfortable, you want to cuss. And cuss is a very specific script within team steps. When you see something and it bothers you, you say, wait, I am concerned. Concerned should be a red flag for everybody on the healthcare team to say, stop, are we doing the right thing? So I'm concerned with what you're doing to this patient. I'm uncomfortable with how we're handling it. And this is a safety issue. That specific script, I'm concerned, I'm uncomfortable, stop, this is a safety issue. That should be, as I said, a red flag for everyone to take a step back, once again, raise their head above that cloud of confusion and reassess. Are we doing the right thing? Have we lost situational awareness? Have things changed? This was the plan earlier. Is it still the plan going forward? All right. You all should practice using that script. I'm concerned. I'm uncomfortable. This is a safety issue. Stop that line. Advocate for your patient and make sure the right thing gets done. It's definitely what's the best for your patient, and we are all trying to be patient-focused. And collaboration, I'm hoping you all know about collaboration, making sure it's a win-win-win, patient, team members, and the team as a whole. It's a way to get a commitment to a common mission and a common goal. Excuse me for a minute. I did not want to cough in your ear. All right, so those are some tools that you can use to improve teamwork. They take a lot of work, a lot of practice, but you can discuss these with your coworkers and say, you know, we're going to try and practice being advocates for our patients. So we're going to practice advocacy, and we're going to use that CUS script. We're going to use the two-challenge rule when we are in situations that we're uncertain of. Lots of ways to improve our communication, to improve patient safety through mutual support. So what can be the benefits of improved team communication? Well, I think if respiratory therapy is leading that challenge, we can definitely show that we are adding value to our team. We are building a better understanding between our team members, between our team and patients, between our team and administration. We share our expertise, and when we share and when we are working effectively together, it's not just 1 + 1 = 2. It's more a synergistic effect. It's an exponential effect where 1 + 1 = 5. So if I was that patient, I would want you to be working at a 5 instead of just a 2 for me. And if you are communicating more effectively, it builds trust. It diminishes those territorial confrontations, because as much as we'd all like to deny it, we still have that territory, those silos in our organizations that really negatively impact the care we provide to our patients. They delay care, it slows care, and sometimes our patients do not get all of the benefits of our expertise because either we don't feel comfortable sharing or we're prevented from doing what we need to do. So improved communication leads to improved teamwork. All right, so we've talked about tools that enhance and improve teamwork. So there are other tools to enhance interdisciplinary communication and ensure patient safety. I'm not going to go into this too much in depth. You all are familiar with the FAARC format of handoffs and communication. FAARC, Situation, Background, Assessment, and Recommendation, has been around probably more than 10 years now. Most places are using this. If not in handoffs, well then certainly in quick communication situations. And when you hand off a patient, you're talking risky situations. Handoffs are very vulnerable to information degradation, similar to what we talked about earlier. You think of all the handoffs we do with a patient in the hospital. Handoff from shift to shift, handoff from discipline to discipline, when you transport, when you send them for procedures, when you do procedures. If you only have one handoff, the risk for an error is 1%. If you have 5 handoffs, you can have 5 handoffs within a half a day on a patient. Your risk for an error happening goes up to 5%. And if you have 25 handoffs, and that's easy within a patient stay, their risk of experiencing an error in patient care increases to 22%. And that was an article by Nolan in the British Medical Journal in 2000. Very scary stuff. So making sure that we are passing on the right information at the right time and accurately, FAARC is great for that because it concentrates on one patient at a time and it improves patient safety during those handoffs. It is a way to make sure that the person you're talking with increases their situational awareness about this patient. If you are doing a exchange of a patient from one provider to another, let's say I'm going off shift, you're coming on, I'm giving you a report. A good tool to use is I pass the baton, and you can see the acronym there. If I don't know you, obviously I introduce you. This usually happens from one physician to another. If you know the person you're talking to, you don't necessarily have to introduce yourself, but you introduce the patient, you do the assessment, tell them what the situation is, any safety concerns. This is how this differs from the FAARC communication tool. The I pass the baton communication tool is a little bit more in-depth, discussing safety concerns. So that's the I pass the baton, giving them the background, what actions have been taken to this point and what's planned, any timing of interventions that have already been arranged, who has ownership of not only this patient, but who's driving the car, who's making the decisions, who is responsible for the next step, all right? And then what is that next step? So I pass the baton. It's an enhanced tool for information exchange. Somebody said maybe if RT shift reports utilize this format, we would have less missed chances for improving our care. And there are a few additional communication tools you're all familiar with. The call out, this usually happens in situations like traumas and codes. One person calls out what they need so that everybody in the room knows what's going on. And the check back is a way to verify that you've heard a request for something. Here's what I'm providing. So somebody will yell out, I need a blood gas. You can say, okay, I'm drawing the blood gas now from the right femoral artery. Blood gas obtained. Okay. All right, we heard you. The blood gas is on the way. Send it to the lab. So that's the check back. Additional communication tools. It sometimes seems intuitive, but sometimes those steps get missed. And these are critical communication pieces that help everybody be on the same page to know what's going on. If you didn't yell out that you'd gotten the blood gas, how would I know that if it's a crazy situation like a code or a trauma? And the outcome of improved interdisciplinary communication, as we've discussed, it's a shared model. Everybody knows what's going on. Everybody has an accurate picture of the patient's situation, of the plan of care, where we're going, and everybody is on that same page. It allows everybody to be more adaptable because they trust each other. I know what you're doing. I know what your plan is. I know how it fits in with what I want to do and my plan. So if you have a change, then I can more easily adapt what I need to do because I understand what's going on with you. It gives you a better team orientation. Everybody, if you're on the same page and if you're working your plans together, how can you help but feel like more of a team than when everybody is working at their own pace, in their own little silos, with their own tunnel vision? So if you want to grow your team, you have to improve your communication. It grows trust. If I work with you all the time, if I know how you communicate, if you are always very thorough in your communication, if I know every little bit about what's going on with you, I'm going to trust that you're going to tell me what's going on, that you're going to tell me when things go wrong, that you're going to keep me honest and watch my back and catch my mistakes, and I'm going to do the same for you. We're going to learn to trust each other and function at a higher level, and that's where that increased team performance comes in, and all of that will enhance patient safety. It definitely is the right way to go. So in conclusion, I know that was a lot of information. As I said, if you go through the Team Steps training, you will get that information a lot more in depth. This was a very high level, 30,000 feet overview of some of the tools that they teach, but I think that anyone can practice improving your situational awareness, improving your communication, working as a better team member, and knowing that just because you said it doesn't mean you communicated. And that's all I have. So Shauna, any questions?
Cheryl, thank you so much. We actually do have a couple of questions that I've come across. The first one asks whether or not you think that steady working partners is a good idea.
I think there are pluses and minuses to that. Number one, when you work with the same group of people all the time, let's say that you are the ICU therapist and you always work in the ICU, never anywhere else, I think you can develop really good working relationships with that team. They come to know you, you come to know them. A high level of trust hopefully is built up as they become familiar with your work patterns, as you learn how to more effectively communicate and your goals so that they fit into their goals and all of those things we just talked about. So I think when you spend a lot of time with the same group, yes, you can get to a very high level of teamwork. That's the positive. The negative in my view is that if you are, for whatever reason, pulled to a different area, you won't have that. You know, we all have to sometimes get pulled to cover sick time, get pulled in an emergency situation, you know, high census and all of that. You won't have that relationship to fall back on, and you'll feel like you're starting from scratch, and it's a very uncomfortable situation. So sometimes it would probably be better to rotate a little bit and get familiar with a couple different areas, but I am a firm believer in concentrating therapists in one area so that they can build those team skills.
Thank you. I think we have time for one more question. Does your hospital have a way to measure the number of safety events so that you can trend the outcomes?
Yes, we have an online reporting system called Quantros that allows us, we report, obviously it's voluntary still, but as we become, we've had this system for 5 years now, as we become more familiar with it, the number of safety events reported into it on a daily basis has continued to grow. Not that we're any less safe than we were 5 years ago, we're just reporting more. And we can crunch that data in multiple different ways. It's a menu-driven program so that we can get pretty detailed as to why an event occurred, what were the contributing factors, where it occurred, you know, times, units, people involved, you know, how detailed we want to get. We can really drill down. So it's a good tool.
Thank you. Thanks, Cheryl, for sharing that. I appreciate that. Thank you again for joining us today, Cheryl, and to everyone else. For those of you watching this as a live presentation, please stay with us for another couple of minutes for instructions on how to obtain your CRCE contact hour. And if you're watching this program as an archive, this concludes our presentation.